Hey guys, this is Steve, and we're here today to talk about some African American female traction alopecia hair surgery. This type of hair loss, the African American female that has traction alopecia, is one of my favorite types of hair loss. That sounds very strange. Why would I have a favorite type of hair loss? All hair loss kind of sucks, in my opinion. Why is it more interesting, or would be considered my favorite type of hair loss? Because the African American female traction patient does not really have hair loss. So they have loss of hair that is taken out of an area specifically, and normally always in the very frontal zone, which we like to call their edges. Why is that important? Well, that's important because we don't have to worry about them losing any more hair. And what we like to do in regards to hair transplantation is the final step called hair restoration. When it comes to the African American female patient, we don't have to go through any of that. Their hair has been pulled out over the course of their life simply by various different hairstyles, which I personally think look amazing, but it puts a lot of tension on the hair. That could be either braiding or extensions or any kind of weaving or things like that. So normally what happens is the more fragile hairs in the frontal zone, in the hairline, and in the temporal peaks on the sides are pulled out. They kind of add to that a little bit with wearing wigs to cover that up. And what that'll do is that'll put more stress on that zone in the frontal part of the scalp. I've seen young girls, African American girls, at as young as 14 that have come and reached out for help. And once the hair is considered traction and it falls out, it's not going to grow back. As long as we've identified that it's traction, and there are ways to do that, and I will talk about that in a few moments, the traction alopecia is not going to spread. So that's the good news. Most African American females, or I should say most African Americans, most African patients, have really strong hair. The three top hair types in the world are Middle Eastern, Spanish, and African. The African hair, or African American in most cases here, is really good quality hair. So that's something that we like to work with because it'll make the procedure or the results of the hair transplant even better. The downside of African American hair is that it's more sparse. It's not as dense. So the first thing we want to talk about with the female African American patient is, do you have traction alopecia? In most cases, if I had a gun to my head and had to pick out a number, I would say of the ladies I speak with, probably 98% do have traction alopecia. But there's no way that we know that for sure until you've gone to a dermatologist. And it has to be a dermatologist with some experience in the female traction alopecia. For instance, we have a doctor in Brooklyn, Dr. O.C. Tutu. She's a super intelligent doctor that knows exactly what she's looking for. If you don't have access to Dr. Tutu, or in Austin, we have other doctors as well to go to, so that we can be confident in a biopsy to be put under a microscope and then determine that, yes, this is traction alopecia. So once it's identified as traction alopecia, and that's very important, because if it's not traction, the hair is not going to grow. The better doctors in the country, if you're calling in from out of state or out of the city, they're going to ask you to go see a dermatologist or go see a highly recommended doctor that has experience with female traction alopecia to determine that it is traction alopecia. Now, once we've identified that it is, or you've identified that it is, that's when this starts to get exciting. Exciting in regards to restoring your hair. Now, I speak to a lot of patients every day, and I tell them all the exact same thing. I tell them to consider preventative treatments, to make sure that they visit a few different clinics, that they get some different opinions. And they can always come back to me for any reference or any questions. When it comes to the African American female patient that I speak with, I tell them all exactly the same thing. So let's start off with the edges. So let's take a look at one of our patients. Now, most of you ladies that are calling into Dr. McGrath's office have seen this young lady's video, and you're all blown away by the results. I am as well. I think she's absolutely stunning, and I think her result is outstanding. Let's take a look and drill down a little bit deeper into what she went through to get there. So this is her actual surgery day. She's had 2,500 grafts transplanted. These are photos taken at the very end of the surgery once the last graft has been placed. This is the left side of her head, and you can see all that work that's done. This is the right side of her head. I'm sorry, this is the right side. And this is her brand new hairline. And you can see the artistry in how that's designed, which is really cool and really nice. You can see how aggressive Dr. McGrath was in designing that hairline, and that is what she wanted. So that area, left side, right side, and the front hairline is 2,500 grafts. Where we couldn't get exactly is back into this back area back here. And this didn't really matter to her. It was something we didn't know if we'd get there. And that's important to note because I want to explain something else right now to you in regards to the graft count. Not to make this complicated, but let's just say for argument's sake that she was actually missing hair another inch along this back line. So let's say that we didn't have as many grafts as we needed, meaning 2,500 didn't make it. What is not going to happen is you're not going to move this line back. You're going to get that hairline you want. You're just not going to be able to go back far enough, and you're going to have to compensate for that with styling options until the second procedure. And we're going to talk about that in a few moments in regards to the second procedure. Another angle, back to the hairline. If this hair loss was further back, we wouldn't be able to get back into that area because what you don't do is spread them out. Let's go to the other side one more time. If this hair loss was further back, then we would have to stop at this edge right here. And then that would take a second procedure to fill that in. So now let's look at what she looks like from photography standpoint in the final result, which is absolutely stunning. It's incredible. There's her new hairline in that exact design. Here's one side of her head with her hair pulled back. It's hard to believe that this was our surgical girl. And here's the other side. Fantastic. And she looks amazing. And she's she is the patient in one of the videos, her video, that we have. I believe she's from Mississippi, and she didn't want to expose who she is. She just wants to help others. So she allowed us to shoot that video. Now, what I want to do now and make very clear to you, anyone who's watching, is I want to show you the weakness of her result. You might say, well, what are you talking about? She looks outstanding. Well, you be the judge. This is one procedure. So if you look very close, right in the front edge, where Dr. McGrath's teams have all used microscopes and made these all single-haired follicular units, it's not as thick as it is with the rest of her scalp. On the sides, you could have an argument that this is not as thick as the rest of her beautiful hair. And you can see that as beautiful as this looks, it is not as thick as maybe you would want it, or maybe even expect it, no matter how many times I tell you that you should plan on 2 procedures. So let's talk about 2 procedures. So every single African-American female patient is going to be told by Dr. McGrath's team that they're going to need 2,500 grafts. What if you have an argument that says, gee, I'm looking at her photos, and I don't think that my edges are that wide. I don't think that I need that much hair. Well, the first thing I'll tell you is we could all use as much hair as we can get, and you're going to want as much hair as you can get. But the second thing I'll tell you is if you don't need that many, that's a surprise. And I guess that would be considered a surprise to the upside, meaning if Dr. McGrath does not need 2,500, he's not going to use 2,500, and you're not going to be charged for it. However, you want to make sure that you go into these procedures kind of looking at the worst case scenario, whether I shouldn't really use those terms. You just want to know what's the maximum that I'm going to need. And every single patient, every single African-American female, to make it fair so that they're not surprised the other way, gets told 2,500 grafts. Imagine if someone like me were to do a consultation with someone like you and tell you, well, I think you'll be safe with 2,000 grafts. And then you get in front of the doctor and he tells you you're going to need 2,500. That's not a nice way to start the day. So we want to make it very easy for you to understand what can happen on the morning of the procedure, through the procedure, post-operatively, through the healing process, and of course, the final result, which we just discussed. So back to our patient that I just explained to you, which is on a video that we're very proud of. She's very proud of. She's talks about it as life-changing. I talk about it as life-changing. It's not as thick as the rest of her hair. So as you're considering signing up for one of these procedures, you're considering undertaking one of these procedures and spending all this money, you need to be prepared that it's a combination of many different factors that can decide on whether or not a second procedure is going to be necessary. In any given zone, you want to have them dense packed. So if there's any more space that's needed but can't be filled, you're going to need a second procedure. If you just have expectations that for some reason, where I want the best possible hair I can get in the history of this industry, you're going to need 2 procedures. If you're like me, I lost my hair at 18 and I never seemed to get back what I wanted. Dr. McGrath just did a surgery on me 14 months ago and restored my hairline and my temporal peaks, which is a lot like what I just showed you with that young lady. And I'm so excited about it. And I'm so kind of over the top with I finally got what I wanted. I want more. Who doesn't want more? And not a lot. It's just a little areas of weakness that I think it could improve my appearance. There's nothing wrong with that. What we don't want to have happen is for someone to say, well, you know, you guys in the industry, all you show are your best results. All you show is people that it looks so good. And then I didn't end up looking like that. And I don't know why. And it wasn't explained to you that there's different hair types. There's different calipers of hair, the thickness of the hair. Some African-American females have some sort of a descendant that could be Spanish, Caucasian, European, somewhere that can make the hair a little bit straighter. So that could allow them to wear a little bit longer and cover over those areas of weakness. Others are pure African, meaning they have no other descendants from any part of the world, and their hair, although strong, tends to be more kinky and curly. So now what I'm going to show you is, I'm going to use a couple men as an example so I can explain to you what I mean by that. This is a patient of Dr. McGrath's, and this is obviously a male patient. You can see from the forehead up, and he had a lot of hair loss in the frontal zone, African American. This is going to give you a great idea. It doesn't matter whether it's male or female, of the power of the African American hair. So here he is before, and then here he is after, and this is just one procedure. Now, you know, you're going to look at that and say, wow, that looks incredible. Okay, yes, it does. That's a great surgery. He chose a great surgeon. He was told everything you're being told, and it all worked out. And his hair was completely restored in the frontal zone. However, because I'm an aesthetic guy, he's wearing it a little bit longer than I will say most of the young men, African American, want to wear it nowadays. So let's take a look at a different patient. Let's take a look at what he looked like before, his head down, and he has a lot of hair loss in the frontal zone, and he needed his whole frontal third restored. A year later, after his procedure with Dr. McGrath, he comes back very pleased, but he wants another one, knowing when he went in, because he wants to wear his hair very low. You can see the spacing in some of the areas, and that's due to the fact that with the strong African American skin type, even with microscopes, you can only place these grafts so close together. So the shorter your hair is, the more you're going to expose the space between the grafts. Think about it. Let's go back to our young lady we were just talking about. From an aerial view, a helicopter view, looking straight down, you can see in where the transplant was done and where her hair had started. Think about it. She has a wall of hair. She has very good quality hair. We've already talked about that. That's that African American hair. And now we're going to try to replace the frontal zone where she had nothing. And although you can't really see this transition zone, when you look at it from the front, you can see it from the top because it's exposing the fact that you're looking kind of down on the cornfield instead of straight into it. Here's the same shot, but it's looking straight in. I don't want to confuse everyone, but this is very important because it's very important to you to understand what to expect in your 4-month, 8-month, and 12-month follow-up. What should you expect the cost to be for your hair transplant procedure? Dr. McGrath in Austin, Texas will charge you $5 per graft. He will only do FUT on an African American female. That's a $12,500 procedure. There's $350 in additional fees. That's a healing kit and medicines. So that's $12,850. And you're going to be told by me, by the team, by Dr. McGrath, you should plan on 2 procedures for all the reasons we just discussed. This young lady that we've been showing over and over, and many of you have viewed on our YouTube channel, she's blown away happy. Does she want more hair? We haven't heard. We don't know. Would she like more hair? Everybody would like more hair, especially when they've had hair loss, but she looks fantastic. So it's my job, because this is what I do, to give you the right information based on what to expect. Does everyone come back into Dr. McGrath's clinic and do a second procedure? No. However, going into the first procedure, they need to plan on that. That could be a year later, that could be 5 years later, that could be 10 years later, and that's in any given zone. So the components of who you are, meaning how much space do you have? How much hair was pulled out of your head? How strong is your hair in the back? Can we even get 2,500 grafts in one procedure? Are we going to be able to cover the zone and dense pack it properly in one procedure? After it's grown in 12 months, are you going to be pleased? And are you going to be content? Or are you going to be like me, where you want more hair? We don't know. I don't know if you know, but going into this, spending this kind of money and knowing that it's probably going to take 2 procedures is very important for this partnership to move forward. So any of you African-American females that are searching out there for someone to help you, I can tell you that there are numerous doctors around the country that I personally have relationships with that do great work. I think it's very important for you to know everything before you get engaged in considering spending this kind of money and having this done. What I can tell you is if you choose the right doctor, right clinic, like our young lady on our YouTube channel, it's the best decision she's ever made. I hope this helps.